COVID-19 vaccine, myth versus facts. How vaccines work, an easy mental image. A misconception exists that vaccines transform us into totally immune beings, able to instantaneously smite any virus we encounter. Sten H. Vermund, an infectious disease epidemiologist and dean of the Yale School of Public Health, likened this false idea to a bug zapper. As soon as it touches my mucosa or skin or genital tract, boom, zap, it's gone. Not quite. Instead, Vermund said, vaccines are more similar to poison traps, into which a pest might fall, wriggle a bit, then perish from insecticide. The information about the COVID-19 vaccine is constantly changing. At times, there are weekly, even daily updates. Please communicate with your medical provider to get the latest up-to-date information. There are links at the end of this presentation that you can follow to see up-to-date information as it is available. Myth: people with underlying conditions should not get the vaccine. Fact: one serious piece of misinformation is that the vaccine could harm or kill you if you have underlying medical conditions. The vaccine trials included healthy and people with chronic conditions, including those living with HIV. The vaccines were found to be highly effective in all populations included. Myth: the vaccine was developed really fast, so they cut corners to get it done, and it may not be safe. Fact: there were no corners cut in regard to scientific process and safety. The mRNA technology behind the new coronavirus vaccines has been in development for almost 2 decades. Vaccine makers created the technology to help them respond quickly to a new pandemic illness, such as COVID-19. Myth: the vaccine cannot be taken by women who are pregnant or breastfeeding. Fact: one false theory is that the vaccine will cause the body to attack the placenta. There is no scientific backing, and there is zero evidence that the antibodies created by the body to fight COVID-19 have any impact on the placenta or its development. Fact: continued. As of September 2021, evidence shows COVID-19 vaccines are safe for women who are pregnant and don't cause infertility for women wanting to get pregnant. During the clinical trials for COVID-19 vaccines, the same percentage of women who had been vaccinated as those who received placebos got pregnant after having been vaccinated. Fact: continued. As for breastfeeding, the vaccine does not make its way into breast milk. However, protective antibodies will be passed on to the nursing infant. Myth: the vaccine may give me COVID-19. Fact: the vaccines do not contain live viruses, so there's no way for someone to contract the virus from the vaccine itself. The vaccine helps your body make antibodies against the virus, and during this process, you might feel ill for a day or two, but that's not the same as getting the disease. Myth: the new virus strains are resistant to the vaccine. Fact: the virus continually mutates, like many other illnesses. Several new strains of COVID-19 have made the news because they spread more easily and may make people sicker. The current vaccines have been tested against these new strains, and current evidence suggests that getting the vaccine will still have protection. Myth: if you already had COVID-19, you do not need the vaccine. Fact: due to the severe health risks associated with COVID-19 and the fact that reinfection with COVID-19 is possible, people are advised to get a COVID-19 vaccine even if they have been sick with COVID-19 before. At this time, experts do not know how long someone is protected from COVID-19 after being sick. Myth: receiving an mRNA vaccine will alter your DNA. Fact: mRNA stands for messenger ribonucleic acid and can most easily be described as instructions for how to make a protein, or even just a piece of a protein. mRNA is not able to alter or modify a person's genetic makeup or DNA. COVID-19 vaccines that use mRNA work with the body's natural defenses to safely develop protection or immunity to disease. Myth: vaccines can cause autism. Fact: vaccines do not cause autism. This incorrect claim stems from a study that has been discredited. Unfortunately, this flawed study has created much misinformation. Multiple studies have shown that there is no link between receiving vaccines and developing autism. Myth: vaccines have microchips and are used to microchip people. Fact: this is entirely false. This is a myth that stemmed from misinformation on the internet. Myth: I cannot get COVID if I am fully vaccinated. Fact: Dr. Walensky said in the email, a modest percentage of people who are fully vaccinated will still get COVID-19 if they are exposed to the virus that causes it. Still, most vaccinated people with a breakthrough infection are likely to have mild symptoms. Here are links to the information shown in this presentation. There are also links to videos which have more information. Thank you for watching.